Is that burning feeling in your knee and thigh keeping you up at night? Let's figure out what's going on and how to fix it without surgery. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're talking about a very common and frustrating problem, a burning sensation in the knee and the front of the thigh or quad. This can be mild and annoying, or it can feel sharp, hot, and even interfere with your sleep or ability to walk. We'll walk through what might be causing the burning pain, how we diagnose it, and most importantly, how we treat it using non-surgical options, first and foremost, that actually work, without relying on riskier procedures or medications that only mask the problem. So what do we mean by burning pain? When a patient says they feel a burning pain, that gives us an important clue. It frequently means nerve involvement. Burning pain typically means a nerve issue, not just a muscle or joint problem. It could be from a pinched nerve, nerve irritation, or inflammation pressing on or affecting the nerves that travel from your back down to your leg. An analogy. Think of your nerves like electrical wires. If the insulation is damaged or something's pressing on the wire, it can send out the wrong signals like burning, tingling, or numbness. Let's break this down into a few categories to make it more digestible. First off is spine and nerve issues or neurologic issues. Most commonly, a burning feeling in the quad or knee starts in the lower back. And yes, that's even if your back doesn't hurt. Lumbar radiculopathy means a pinched nerve in the lower back. This often occurs from a degenerative disc or bulging disc. Pain can radiate down the front of the thigh and into the knee. Neuralgia paresthetica is when there's a pinched nerve in the pelvis, the lateral femoral cutaneous nerve. That can cause burning on the outer part of the thigh. This is common in people who wear tight belts, are overweight, or have diabetes. As an example, a patient comes in with burning pain on the outer thigh. They have no history of injury. It turns out it's from sitting with a tight belt compressing that nerve all day long. Treating the nerve compression appropriately helps to reduce the nerve pain symptoms. Sometimes the burning comes from inflammation around the knee or thigh muscles themselves. Overuse or trauma to the quadriceps muscle can irritate local nerves, the peripheral nerves that sit around the joint and the tendons as well. Also, inflammation in the bursa, which is a fluid-filled sac that cushions the joints, can also affect nearby nerves as well. As an example, a runner who suddenly increases their mileage may develop burning pain due to muscle fatigue and local nerve irritation. Another one to consider is if you could have a systemic, autoimmune, or metabolic issue. If you have a history of inflammatory arthritis or autoimmune disease, nerve inflammation can be part of a bigger picture. Conditions like lupus or rheumatoid arthritis rarely can inflame the nerves, more frequently can cause soft tissue irritation, however. Diabetic neuropathy is also a common cause of nerve pain if your blood sugar is not well controlled. Typically, that's more discomfort below the knee, but on occasion, if it advances, it can also extend to above the knee as well. The key to proper treatment is understanding the root cause. Here's how we do that. Step one is by obtaining a detailed medical history from you. When did the pain start? Is it worse at night, with walking, sitting, any numbness, weakness, or tingling symptoms? Step two is a good, focused, detailed physical exam. We check your back, your hip, your thigh, and your knee. We test your strength, reflexes, and sensation. Step three is to do any additional imaging and testing. May have to do a MRI or X-rays to evaluate the spine, hip, or knee. A nerve conduction study is sometimes done to assess nerve function. Blood tests if an autoimmune disease or metabolic issue is suspected. Ultrasound can also be utilized here to evaluate the knee joint, tendons, bursa, and ligaments around the knee if those structures are possibly involved as well. Remember, the burning might feel like it's in the knee, but we often find that the cause may be coming from elsewhere, especially the lower back. At Chicago Arthritis, our goal is to heal the root problem, not just cover up symptoms, and we do this typically without surgery. First line option should always be low-risk conservative care, stretching and strengthening exercises, focus on the lower back, hips, and core. Anti-inflammatory nutrition and targeted supplements like omega-3s, turmeric, or alpha-lipoic acid for nerve pain should also be approached. Weight loss if needed to reduce pressure on nerves and joints. Simple tip, avoid long periods of sitting or tight clothing that can irritate the nerves as well. If conservative care does not resolve your symptoms, we have highly targeted injection options. The ones that I would recommend for this kind of pain would include the following. Prolotherapy, where we utilize a natural solution such as sugar water that helps to heal and stabilize irritated tissues. Platelet-rich plasma, or PRP, uses your own body's blood platelets to reduce inflammation and promote healing. And then there's bone marrow cell therapy for advanced cases involving joint or soft tissue degeneration. We'll use your body's own bone marrow cells, including stem cells. In general, we try to treat and focus on the issue that is damaged or inflamed. For example, if you have a lower back pinched nerve, we'll inject around the nerve with platelet lysate, which are the growth factors from your own platelets. This will help to reduce inflammation in the nerve longer term. Then we'll also treat the surrounding soft tissue structures, ligaments, tendons, and muscles, inject into them as well, to strengthen them, reduce instability, reduce pressure on the nerve that is being impacted as well. By treating comprehensively and accurately, we can longer term reduce inflammation, improve instability, resulting in reduced pain and better function, and overall improving your quality of life. Unlike steroid injections, which can harm tissue over time, we focus on treatments that heal, not harm. What we try to avoid are steroid shots, and certainly not repetitive steroid shots, which may reduce inflammation temporarily, but can weaken tissue longer term. Surgery, if done too early, especially if the problem is nerve-related, cutting into the knee or the hip won't typically help. If your issue is more nerve-related, it may just cause more instability. In some cases, let's say you have significant weakness that's developing the leg, then spinal surgery may need to be considered or at least evaluated, because that may be something that needs to be treated a little bit more urgently. Nerve ablation is another frequent treatment where the physician may actually burn the nerve. I recommend to try to avoid that. It can lead to short-term pain relief, but long-term it can lead to more instability and damage because the muscles that are affected by that nerve are now weakened over time. Here are some common, frequently asked questions and misconceptions. Is burning pain a sign always that the nerve is permanently damaged? Not necessarily. It often means the nerve is irritated but not permanently damaged. If we treat it early, you can still recover significantly or fully. Question 2 is, should I see an orthopedic surgeon? I'd say only if conservative options have failed. Most people do not need surgery for this kind of issue. Another question that I hear is, can this go away on its own? Sometimes that can happen, but if the pain is frequent, severe, or interfering with your life and not resolving within a couple of weeks, you should not wait. The earlier we can treat it, the better the results. Burning pain in the knee and quad can feel scary, but most of the time it's very treatable without surgery. The key is figuring out whether it's a nerve issue, local irritation of the peripheral nerves and tendons, or part of something bigger like a metabolic or autoimmune condition. At Chicago Arthritis, we utilize a personalized step-by-step approach that starts with the least invasive options and works toward true healing, not just temporary relief. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. And if you're interested in a consultation, you can contact us via our social media sites or our website, chicagoarthritis.com. Until we connect again, have a good day and live well.